Welcome back on the YouTube channel. A man in white coat. So let me start with the topic otitis media. So let me start from the definition. One by one we will cover all these points. So what is the definition of otitis media? So definition of otitis media is an infection or the inflammation of the middle ear, common in infants and the young children due to their shorter or the more horizontal Effusion tube. So otitis media is infection or the inflammation of middle ear. Suppose this ear and it's a middle part. So infection is here, means behind the tympanic membrane. So infection or the inflammation, or we can say the fluid accumulation in this middle ear, it will consider as the otitis media. So what is the etiology, means causes of otitis media? The first one is bacteria, then the virus, then the Eustachian tube infection. So first one is bacteria. So because of the bacteria there is chances of otitis media. Then the viral infection. So here common cold is very, means common viral infection. So because of the viral infection, or we can say the upper chest infection, it is the cause of otitis media. Then classification. So basically there are three type of classification of this otitis media. The first one is acute otitis media, means it's a sudden infection with the pain and fever. Means acute means what? Short time of duration. So because means first one is acute otitis media, means in this there is a very short time of duration of this otitis media. Then second is otitis media with effusion, means fluid without infection, means there is no infection in ear but only fluid is there, means fluid accumulation here in middle ear, or we can say we can observe the discharge through this ear. It will consider as second one otitis media with effusion. Then the third one is chronic otitis media. Chronic means long time duration. So long term infection with discharge. So there is chances of discharge also and the long time duration. It will be considered as chronic otitis media. So these are the types. Then risk factor. So what is the risk factor of this otitis media? First one is bottle feeding in lying position. Suppose there is a baby and is feeding bottle by in lying position, so there is a chance of otitis media. Then the upper respiratory infection, means upper respiratory infection means from the mouth to here, tracheal infection. So it can be cause of otitis media. Then poor immunity, means a baby's poor immunity, means immunity power of that baby is very poor, and loss of appetite. Then the sign and symptoms. Sign and symptoms means here we have clinical manifestation. So first sign means ear pain. Then child pulls ear. So because of the ear pain, child will try to pull his ear. Then the fever, as you all know, because of the infection and the inflammation, there is chances of fever. The irritability and crying. So because of the otitis media, baby will irritable and crying also. Then the hearing loss. So because of this otitis media infection, increase of the fluid accumulation in the middle ear, there is chances of hearing loss. Then difficult feeding and sleeping. So because of this otitis media, there is chances of difficulty in feeding in child, and sleeping pattern also disturb of this child. Then the diagnostic evaluation, means which kind of test we have to do. The first one is otoscopic examination, means because of by the help of otoscope we will find the red or plugging or the tympanic membrane, means we have to observe that it is the redness or the plugging in the middle ear or not. Then hearing assessment. So there is a lots of means way to hearing assessment. Suppose there is a instrument by which we have to just stick here and listen here. So these are the means type of checking the hearing loss or not. Then the medical management. So which kind of medical management we have to do? first one is analgesic and antibiotic. In example, paracetamol. So analgesic means because of the pain we have to provide analgesic, and the antibiotic means because of the fever we have to provide, maintaining the temperature of the body, we have to provide that antibiotic. Then the antibiotics means because of the bacteria we have to provide antibiotics medicine. Here example of the antibiotic medicine is amoxicillin. Then sometimes discongestants sometimes. Then the nursing management, or the nurse have to do. The first one is assessment. Assessment means nurse have to check. What? Check the pain level, which means level of pain. There is a pain scale, and we have to check that pain level of that. We then monitor temperature as in what? Clinical manifestation means signs and symptoms. We have find that the fever, so there is nurse have to monitor the temperature of that baby. Then to observe the ear discharge. So because of the otitis media, fluid accumulation here middle ear, so it's chances of discharge. So nurse have to find out the what? Observation the ear discharge. Then assist the hearing and feeding behavior. So nurse have to assist means hearing and the feeding behavior of child. Then the nursing diagnosis. The first nursing diagnosis is acute pain related to inflammation. So it's very simple, because acute pain is chances of pain because of the inflammation or infection. Then the risk of infection spread. So because of risk of infection spread, there is chances of infection spread. Then the disturbed sleep pattern, and as you all know, because of the irritation, and there is chances of disturbing sleeping pattern of the baby. Then the health education for parents means which kind of health education or nurse have to provide for parents. First one is avoid bottle feeding while lying position. As there is a chances of otitis media because of providing feeding a baby in the lying position, so avoid this one. Then encourage breastfeeding. Means nurse have to educate mother to encourage the breastfeeding. Then complete full antibiotic course. So because of the bacteria, there is chances of otitis media, so nurse have to provide all these antibiotics and full complete full antibiotic course. There is a courses of antibiotics 6 days, 10 days, or whatever the doctor has prescribed. Then the complications. So the most common complication is hearing loss. Because of the otitis media, there is a chances of hearing loss, because here tympanic membrane will be ruptured because of the infection of the inflammation. So it nurse have to tympanic membrane rupture. Nurse have to provide this. It's a complication. Then the speech delay, and because of this there is chance of speech delay. Then the last one is prevention. This kind of prevention nurse or a mother or the baby have to do. First one is immunization. So it's very common. It's very common things that a baby have to take all the immunization. Mother have to provide all the immunization to the child. All the vaccines. Then the good hygiene. A mother have to maintain good hygiene for the baby. Then the proper feeding techniques. As you all know, because of the feeding technique in the lying position, so there is chances of otitis media. So provide proper feeding technique. So hope you understand the meaning of this otitis media. So as the definition there means the inflammation or the infection or the fluid accumulation in the middle ear, it can be considered as otitis media. So hope you understand the meaning of otitis media. Thank you for watching this video. See you in next video. Ciao.